The right ICS stenting went uneventful for a symptomatic right ICS stenosis. 4 months after the stenting, she had recurrent right hemispheric symptoms, and the initial angiography showed that there was a tight narrowing within the stent. She was put on tirofiban infusion, and there was no change in the architecture of the stenosis. She was moved on to low molecular weight heparin. However, she had recurrence, and therefore the plan was to go ahead with stenting. As it was less than 6 months from the stenting, neointimal hyperplasia was considered as the possible reason. The plan was to use a drug-eluting balloon for angioplasty and follow it with stenting. To allow for drug transfer, we prefer that the drug-eluting balloon is inflated for at least a period of 60 seconds. To avoid bradycardia, a temporary pacemaker was inserted. The filter device is taken across the stenosis, following which a drug-eluting balloon angioplasty was performed. The balloon was kept inflated for nearly 90 seconds, and the bradycardia was taken care of by the pacemaker. The post-angioplasty run made us suspect that there was a clot superadded to the intimal hyperplasia. A C-guard, almost like a covered stent, was placed across this segment. Note failure of expansion of the stent at the mid-segment, and therefore a balloon angioplasty was performed post-deployment of the stent. Following this, there was good antegrade flow, and there was good wall opposition of the second stent. There was no intracranial embolism that was noted.